Hello there, this is Dr. Brownhilda Santo. Today we'll talk about the part two of the syncope lecture. So we're going to talk about the other two types of syncope, the orthostatic hypotension syncope and the cardiac or cardiovascular syncope. So for part one, we'll be talking about vasovagal syncope. So refer back to the part one video if you never already watched them. So what it be syncope or fainting. Now when you get it happen when you get a transient or brief loss of consciousness because of decreased blood supply and hence decreased oxygen and nutrition to the brain because of low blood pressure, and it be transient, lasting just about 1 to 2 minutes and not more. And if it start last longer than that, you get for suspects that maybe something else will happen, and the person will just wake up or get out of that syncopal episode and then just carry on their day like nothing not even happened. Now, what it be orthostatic hypotension syncope? This one they happen now when person move, if you move from lying or sitting position to standing position like a stanso, and then you get a abrupt and a big drop in your blood pressure, and that will cause you now to have lightheadedness, and then you feel pass out. What will be some of the things and way feel predispose person for get this orthostatic hypotension? Dehydration. You know, if you sweat a lot, if you urinate a lot, maybe because you dey on water pills, diuretics, when a type of blood pressure medication where they make you urinate a lot. Maybe you vomiting or diarrhea. Sometimes also if you stand a lot, especially under a hot weather, if you sweat a lot, now some of the things in this way, it will predispose you. Sometimes some medical conditions like long-standing diabetes will never be well managed, or even some particular type of dementia called Parkinson dementia, or some other neurological diseases where it affects how your blood vessels, the tonicity, yes, how your blood vessels they contract and they relax, or it affect your heart rate. Those diseases until they feel cause you for get this orthostatic hypotension. And as a result of the orthostatic hypotension, meaning your sudden and big drop in blood pressure, now you feel also pass out. Now, what will be some of the signs and symptoms? In fact, like that vasovagal syncope we'll be talking about, for this orthostatic hypotension syncope, you also get warning signs. What will be some of the warning signs? You feel nauseous. You feel be lightheaded. You feel get palpitation. Your heart they beat very fast. You just feel fatigue. Some person go even look at you. You look pale. You know, like say you go pass out. Now, what will be some of the things that we'll do for prevent we from getting this orthostatic hypotension? Well, if you want move from a lying or sitting to an upright position, take your time for doing. Keep yourself hydrated too a lot, especially if you know so you for go out for hot weather. When you wake up for morning time, if your blood pressure tends for be low, drink water at least 500 ml, half liter. And during the day, maybe 1.5 to 3 liters of fluid intake. Also take salt, salty diet, increase your salt intake. Sometimes if you really overbat, doctor will give you some particular medication them. I will defer that one because I don't want to talk about any medication where some person go take and we be regulated. If you also get for stand for a long period of time, then you feel wear compression stockings for help for maintain blood supply to the upper portion of your body. Now more talk about cardiac or cardiovascular syncope. Usually it happen when you get like irregular heart rhythm, or when you get very fast heart rate or very slow heart rate. And this, if it lead to your heart not getting enough time for fill up and cause you for pass out, or if you get some really irregular heart rhythm where it will just cause you for pass out, and some people they even go into cardiac arrest. The other thing where if it cause antuna, if you get something where they call and say aortic stenosis. Aortic valve now the valve way through which the blood from the left side of the heart they pump out into the rest of the body. If that aortic valve be narrowed, stenosed, you know, go get enough blood where go be pumped out of the heart, and then as a result, you know, if you get lightheaded because you know get enough blood where it be supplied to the brain, and if you pass out too. Some people them too, that left side for their heart there, so it be the walls and be so thickened, and in that case sometimes it be so thick where they obstruct even the outflow of blood out of that left side of the heart into the rest of the body, and they feel also pass out. Sometimes people that with that condition even they feel get irregular heart rhythm too. In fact, sometimes some athletes or some people when they play football or they run or do activities and they feel just suddenly just drop, they get at this condition. Some people then also feel get heart failure from a heart attack, and if you cause you forget a weak heart, and as a result, you know, if you get irregular rhythm, and if it cause you for pass out. So unlike vasovagal syncope and orthostatic hypotension syncope, this cardiac syncope normally usually need to give you, typically need to give you any warning sign. So person feel just the waka, so then boom, it just drop for down, and then after about 1 to 2 minutes you just wake up like say nothing no happen. But it be dangerous because if you did drive, if you get into an accident and you feel hurt yourself or hurt somebody else, or if you there for corner fire, you feel actually fall and just burn yourself. So it be a little bit dangerous because it need to give you warning signs, so you don't get time for even adjust like that other type of syncope them. Now, some other type of things that way they feel cause syncope in a low blood sugar. If your blood sugar low, if it cause you forget for pass out or for faint. Medication then too, they feel cause you for faint, especially medication the way they lower your blood pressure or your heart rate. In fact, blood pressure medication they feel do them, and sometimes some of those blood pressure medication the way like that diuretics, the one that they make you urinate, they feel also make them predispose you for pass out. And in that case, your doctor get for regulate your medication. In fact, if you eat right and you do lose weight, sometimes the same amount of blood pressure medication where they take and the same dose, it may be too much even. So if that is the case, then you know your doctor will adjust your medication, and it's advisable even say every day maybe you check your blood pressure, because you never know, sometimes you may not need too much a lot of medication, especially if you start feel lightheaded or you feel like you go faint. Make sure say you check your blood pressure and check your heart rate also before you take medications. Because this cardiovascular syncope, if it be serious, if you pass out without any warning sign, or if you feel like say your heart beat very fast and irregular and then you pass out, please make sure say you go see your doctor. They get for make sure so you don't get any heart problem. They feel do something like an ultrasound of the heart, echocardiogram, for look at that your heart valve, or for even check for see if the left side of your heart be the muscle be enlarged, or if your heart be weak in general. Sometimes they go even give you some monitor where you go take and go down for house. You know, you keep them for some time for see if you go catch that irregular heart rhythm. If you get a very low heart rate where it cause you for pass out, or if you even get heart block where the heart rhythm, you know, the electricity for the heart they work well, and it be so low where it cause you for pass out. Sometimes they way they feel even give you pacemaker where you go act like artificial electricity center for make sure say your heart day within the normal range. And if your heart over fast too some kind of way, especially if it be irregular too, sometimes if you give you certain medications them for help for slow down the heart rate, for prevent you from passing out or from getting these symptoms the way you go make you feel like say you feel pass out. So I hope say when I won't be able now for understand this fainting and some of the things the way they cause them, and what to do when you faint, and also when to seek medical attention, and some of the precautions the way you get for take them for prevent fainting. Please share this video with your friends and family as if it helps someone. And also remember that knowledge is power. Thank you. Dr. Brownhilda Santo.